Go ahead.
Hey everyone, Dr. Franchino here from Total Health Center in Berkeley Heights, and today I'm here with Carly Alahanti. How are you today?
Good, I'm excited to be here.
Excellent. And today we're here to talk about one of the specialties that we have here. It's called occupational therapy, and she is an occupational therapist. So Carly, can you please tell our audience what an occupational therapist is?
Sure, so occupational therapy is a type of rehabilitative therapy that uses everyday life activities in our treatment. So let's say, for example, somebody comes to me and they're like, I'm having a really hard time buttoning my shirt. I would go ahead and, help them with that. So then they would maybe bring in one of their shirts and, I would help them with buttoning and things like that. So it uses everyday, life tasks or ADLs in treatment.
Do you have a specialty at all? Because I know some people specialize in strength, some people specialize in strengthening, others have balance therapy, which we call vestibular therapy. So do you have a specialty at all?
Yeah, so mainly with occupational therapy, you'll see us working a lot on the upper extremity. That's, shoulder, elbow, wrist, and your digits or your fingers. Because that's mostly what is, functional. So if you think of anything functional, you'll think of, maybe typing, or like I said before, you'll think of, getting dressed, buttoning a shirt, on your phone. So anything, that's functional, you usually see in the upper extremity reaching for things. I have, a lot of patients now who are, struggling with, reaching something off the top shelf. So, anything more lays in the upper extremity, that's who I say.
Oh, that's perfect, because I was going to ask you from an example. So when people think physical therapy, they think heat, stim, strengthening, stretching. That's their typical treatment program. As a chiropractor, people think, okay, he's going to adjust me, maybe do some soft tissue work.
Right.
So what would be your typical treatment?
So,
I mean, granted, everyone's different,
yeah.
But what's your typical?
Typical treatment is pretty similar to physical therapy. So kind of like I said before, I'm looking at it from a different scope. So, somebody would come in, we would discuss, your goal of treatment. That's really important to me is, when I send you home, what will you be able to do by yourself without help? So we just, discuss goals. Let's say you want to get back to gardening, or you want to get back,
Good time of year for that.
Exactly. You want to get back, to, let's say you want to do some spring cleaning and you want to lift some boxes. So we would discuss your goals, what you want to get back to doing independently. And then we would, go through, let's say, your barriers. So what is limiting you from doing that? And then maybe, pain level, and do a whole comprehensive, evaluation. And then we would start from there. And then, do some maybe preparatory methods. So I'll keep going back to the example of getting dressed, buttoning a shirt, zippering, putting on and off a jacket. We would use something I like to call preparatory methods to do that.
That's very interesting. That's excellent. Now, what are some issues that might cause this? This is my last question for you. So some people might say, well, that's great, but what causes these issues? Are there certain people, certain conditions that you see?
Yeah, so a big one right now is people have something called rotator cuff injuries. That is your shoulder, which we're actually going to get into next week. More so, we'll explain that more next week.
Yep.
But rotator cuff injuries that limits your shoulder movements. So kind of like I said before, reaching for things or reaching behind your back, to maybe tuck in your shirt or to grab your jacket and pull it forward. People are limited in those movements. And
we have seen that here,
yeah, so to be able for them to, get dressed or reach or do anything like that independently, we have to look at their shoulder pain and range of motion, movement, and, so we can get them back to doing things by themselves.
That's perfect. So guys, hope that was very informative. So next week, our topic is going to be rotator cuff, and then our next few lessons and live streams are going to be on the upper extremity, which Carly explained. It's going to be shoulder, elbow, wrist. We'll talk about carpal tunnel syndrome. We're going to talk about rotator cuff injuries and how important shoulder stabilization really is, and how Carly's an expert in that. And if you guys have any questions, give us a call or reach us at totalhealthnj.com right there. So I hope this was very informative. I know I learned quite a bit today. So take care and keep drinking coffee.